All right, it is 10 o'clock, so as promised, we will get started on time. Hello, everyone, and welcome to i3 Vertical's Point of Sales third installment of our webinar series. For those of you who weren't able to join us for our previous webinars, my name is Kimberly Montgomery, and I am the marketing manager here at i3 POS. If you are on our mailing list, I'm the one sending out those emails, posting on social media, and managing all that is marketing here at i3 POS, including hosting our webinars. Thank you so much for joining us today. I want to remind everyone that you are all in listen-only mode, meaning that we cannot hear or see you. We will have time for questions at the end, so please feel free to type your questions into the chat box on the collapsible panel to the right of your screen at any point during the presentation. Please note that this webinar is being recorded and will be sent out via email at a later date, as well as posted on our website at www.i3pos.com. And for today's webinar, we have a guest presenter, Tyler Woods, here to discuss some important and highly requested topics, such as how to bring your restaurant and hotel teams back to work and operating in the ever-changing COVID-19 pandemic. I and our sales director, Richard Cox, will also be briefly discussing NCR Aloha Essentials, mobile pay, i3 Merchant Solutions, and more. So I'd like to take a minute to introduce our guest presenter, Tyler Woods from Fisher Phillips. Tyler is a member of the Fisher Phillips SBA loan team and is dedicated to advising employers on the inner workings of the complex CARES Act loan process during the COVID-19 coronavirus pandemic. And he is here today to discuss the changing restaurant and hotel environment and how you can continue to operate during this unfamiliar time. So without further ado, Tyler, please take it away. And let me just change the screen for you so you can take over here. All right, Tyler, you should have, there you are. All right.
Okay, 1 second. Let me just bring up the presentation.
Perfect.
Well, while this opens up, thank you guys very much for joining the call today. By way of background, I've practiced law here in California for over 15 years. I specialize in employment law. And as Kim mentioned, over the past several months, I have become a specialist in the CARES Act and COVID-19 as it applies to, in particular, restaurants and hospitality industry. That is my primary practice. That is what I do. So let us begin. As you guys probably all know, things have never been changing here in California throughout the country on how to deal with the COVID-19 pandemic. One of the nice things, and it's going back through Congress right now too, a second round, is the CARES Act, which provided for the Paycheck Protection Program, which looks like was changed a little bit with the Paycheck Protection Program Flexibility Act. And being debated right now is an extension of the Paycheck Protection Program that will allow for a second round of loans, meaning that if you've already applied for and obtained a Paycheck Protection loan, you can apply again for a second round if you still need it, given that the pandemic has gone on much longer than expected. If you have already applied for and obtained a Paycheck Protection loan, I encourage you to use it and use it smartly. Make sure you follow the letter of the law to the T, because as the people are starting to apply for forgiveness, they are realizing the rules are very strict on how you can use the funds and how you can obtain forgiveness from the funds. Keeping in mind too that you can use it for payroll costs, rent, utilities, and interest on mortgage. So it can help you keep the lights on. It's an incredibly useful tool that will allow all of our clients, and especially people in the hospitality industry, is they constantly face more and more regulation by the government about how they can operate to make it through these next several months. Now, what do we do now that we're restarting? If you haven't reopened yet, Or if you are already operating, how do you operate amidst all the chaos of COVID-19 and as things constantly change? I mean, they are changing on a local, state, and federal level almost on a weekly basis. So because of that, I highly recommend that if you haven't restarted yet, or even if you're already operating, you need to designate a COVID-19 response team, because this is somebody who will get to know the requirements well and know how to respond. Because now, if you're operating, what you're probably discovering is that you're having employees come to work with COVID-19 or advise you that they have COVID-19, and you need to have a team there that's ready to go, that has already developed the process. And when you develop this and designate this response team, I recommend you have somebody at every level of the company so that people know what's going on across the company and have influence on every facet of it. But COVID-19 presents beyond just the process procedures. It presents, I'll call it, a unique opportunity to reimagine process. Because, for example, in California, they have closed dine-in restaurants, but allowed outside. So you have the restaurants and employers a chance to think outside the box. And as you've probably seen throughout the state and other states as well, people have converted their parking lots into outdoor dining areas. And that is where you can reimagine process. But you also have to reimagine process. That's the fun creative on workflow. How do you reimagine the flow of people, how they walk, your employees, how they walk through the kitchen, how they walk through the utility room, how they enter the building, how they exit the building, how they interact with each other, break rooms, and everything, to make sure that you stay compliant with the various restrictions. You have to develop an injury and prevention plan. In California, that plan must include injury and prevention of COVID-19. So if you already have one, that's great. It has to be updated. So these are the little facets you need to look through here. As part of the injury and prevention plan dovetails in that, is you need to develop new protocols, procedures, and policies for dealing with COVID-19. How do you deal with sanitation now? How do you deal with the cleanliness? How do you deal with the number of hours? How do you deal with people that are calling out sick? How do you deal with people once they're exposed? And all those need to be looked at as part of the initial plan and developed. And an overarching umbrella over all of these is you have to constantly be evaluating and looking at local and state ordinances to make sure that your policies and procedures, your injury and prevention plan, and your processes all remain constantly compliant as things change. So if we I'm going to look at sort of this presentation in two parts. The first part's going to be looking primarily at restaurants, and the second part primarily at hotels. So with restaurants, and a lot of the stuff does apply to hotels, is when you're either restarting or you already have restarted, you need to re-examine everything. What supplies, goods, and materials are used in the operation? How you get them, how you source them, how much do you need? The PPE supplies, do you have enough on hand? Do you have the correct ones on hand? And that's where you need to check your local ordinances. What are your disinfecting protocols? Do they need to be revised to ensure that you meet the new cleanliness requirements of OSHA? For example, in California, like I said, you need to develop a specific injury and prevention COVID-19 plan. You also need to make sure that you have in place, and if you haven't set up one yet, you need to design one. If you already designed one, you need to double check it against a local ordinance to make sure it complies for the health screening of employees, vendors, visitors, and customers. If you transport employees, your plans and protocols need to encompass that. How can you transport employees and still maintain safe distancing? How can you comply with the necessary precautions and rules put in place by the government? And this is one of the biggest ones, because you can do everything great. You can put everything on paper. You can work with your attorneys. You can work with various advisors and make the greatest COVID-19 policies and procedures, the best developed injury and prevention plan. And you could be the gold standard. But if none of that doesn't get passed on to the managers, supervisors, and employees, it doesn't matter. So once you developed all the various COVID-19 compliant policies and procedures, once you've reimagined your process, once you've done your plans, the next step is you need to implement a training program for everyone. And then you need to implement what I'll call an accountability program for the managers, because what has happened for several of my clients is they've gone out, they've done the training, they've done everything great, and then the managers don't enforce it. They've done spot inspections and nothing's been done right, and they freak out because now they're seeing great exposure for liability. And lastly, on this front is signage. Signage can make the whole world of difference, because what you want to do when you, in order to be compliant with, at least in California, the local regulations, is you need signage that advises that masks are required, that tells you need to clean your hands, that you must maintain social distancing. But you can do it in such a way that it isn't like a big yellow flashing hazard sign that scares customers away. Being done in such a way that gives customers the confidence that you care for them and their health and their well-being, and actually invites them in, because if they're looking at your signage versus another company's signage, and yours is inviting and showing like, we're here for you guys, we've taken all these extra precautions, guess what? They're probably going to come to you over your competitor. See here, also just go page down. Just froze on me. There we go.
Tyler, you should have, oh, perfect.
Yep.
You got it.
And so one thing's when you are designing all these plans that you need to be cognizant are the local rules and ordinances as they apply to, for especially restaurants, the occupancy limits. The requirement as of late, the last couple weeks, only outdoor dining is allowed. Face coverings, employee screenings, temperature checks, health screenings, sanitation, signage, and other limitations. We'll go through those time and time again. So if you know anything about California right now, in the majority of the state, not everywhere, but in the majority, only outdoor dining is permitted. And if you allow anybody to come in, you can face major fines. I had a client who is had an elderly gentleman sitting outside. This was in Fresno, Central Valley, 100 degrees out, in 90 degrees in the shade. This elderly gentleman looked like he was in distress. So the owner allowed the gentleman to go inside the air-conditioned restaurant. He was the only person in the restaurant. It just so happened that a health inspector happened to come by at that time. He got dinged $1,000 for violation of local ordinance and state ordinance. So be very careful. Make sure that if you're doing outdoor seating, make sure it's comfortable. It has fans if it's in a hot area, or has misters, so that you don't face these situations. Understand also your occupancy limits. The same requirements that apply to gatherings of 10 or less apply to restaurants. What that means is you have a large party coming in, say 3 or 4 families, you can only allow them to sit at a table of 10. So this is where training comes in addition to COVID-19, to the people at the front of the house and how they deal with customers that have large gatherings. Again, it could just be 2 or 3 families, depending if they're large families. And working with them saying, we can't sit you all together, but we can put 2 tables near each other because we can only allow tables of 10. And you just need to know that, though, so you can address that up front. And again, you don't want these crazy moments that make it to Instagram or social media where you have a customer going crazy at you because you won't allow their families to sit together. Keeping in mind too, in addition to the occupancy limits of no more than 10 people per table, is you must make sure the tables are at least 6 feet apart. And as we've seen in the news every day, we have face covering requirements. In California, it is an absolute requirement right now that everybody wears face coverings in a restaurant or a hotel. It used to be just staff, it used to be recommended, now everybody, especially your employees. It is a detailed by OSHA requirement that if anybody is touching food or near customers or in the public spaces, they must wear face coverings, period. Now also though, customers have to wear face coverings. It is not optional anymore under the state ordinance. It is now required. The biggest issue I get is, must we provide face masks to employees? The answer is yes. It's just like a uniform. I do not recommend allowing employees to bring their own mask, because I had an issue with another client where one employee on the same shift wore a mask that said BLM, black with yellow lettering BLM, and it just so happened one of his coworkers wore just that day, hopefully not by design, to create a confrontation, a red MAGA, Make America Great Again face mask. From what I understood is there were tensions the moment they saw each other. And so in order to avoid those type of things where people wear masks that have expletives on them or whatnot, I recommend that you provide a mask that's just neutral color that sort of meets your color scheme, a straight plain mask of like black, white, navy, or simply provide the blue and white face mask, cloth, disposable face mask that you see everywhere. But they must be provided as part of their uniform and safety. Another thing that must be done is employee screening. I recommend to all of my clients that the best practice is to do a wellness check before the employee reports to work. That can be if you have your employees connected electronically via everybody has email or whatnot, then they can be done. For example, myself, every day I get an email before I go in the office that has a 9 question survey. And it says, have you been in contact with someone with COVID-19 last 24 hours? Yes, no. Have you been near someone that has the following symptoms in the last 24 hours? Yes, no. Do you have a fever of 100.4? Yes, no. And it goes down from sore throat and all the various symptoms. And frankly, it's been expanded with new symptoms or diagnosed and recognized as associated with COVID-19 to every day, because then if I say yes to any of those, I get a huge email that says, do not come to the office, do not report to work, and then immediately goes to the local office manager who then contacts me. If you cannot do electronically, I would advise you to have a paper form, and we have those if you need them, and if not, I'm sure I3 can help you, that you would have somebody fill out before they come on the property, and you either set up a tent or outside in a parking garage or something along those lines that is completed, and a manager will be there with the face mask and gloves to review to see if the person passes the wellness check. Now keep in mind, you will need to add anywhere from a minute to 5 minutes to every employee's time sheets to the extent that they're hourly to compensate them for completing that task. You will also need to do it, and depending on the state, a temperature check. Now you can put that temperature check burden on the employee by asking them whether or not they have 104.4 degree temperature or not. And if you do it on site, then you want to make sure that whoever is doing it has all the necessary PPEs, from face mask to maybe a gown to gloves to whatnot, and is trained on how to take the temperature. You want to use one of the thermal temperatures, trained how to record the temperature, trained what to do if a person does have a temperature over 100.4, and what next steps there are. So the person's and employees' health and privacy rights are protected. And to that end, you want to give what's called, at least in California, a CCPA notice if you're doing that. We recommend if you're doing a wellness check of any way, shape, or form, you just distribute and have every employee sign a CCPA notice here in California, because that covers you from any concern about disclosure of confidential information. And we just talked about. Now, what about customer health screenings? Do they have to be screened? Right now in California, no. Tennessee, yes. Other states are saying yes, but not here in California. I would recommend, however, that in your signage, you make a nice looking sign that says, please do not come in if you have any of the following symptoms. And you list out the temperature, sore throat, cough, all those symptoms. You don't need to screen them, but I recommend that you do have the signage because it'll protect you. Now, OSHA has mandated several new additional sanitation requirements because of COVID-19. The biggest one is it is absolutely required, and so you may have to update your hand wash sheet, that every employee wash their hands at least once every 30 minutes for 20 seconds with soap or hand sanitizer. And this is the other one, every time they use or adjust their face covering, they must wash their hands. Why that's important is because that's relatively new, and when I've gone out to restaurants, I see the servers routinely touch their face mask to bring it down so they can catch a breath or talk to somebody or do whatnot, put it back up, and then come over and serve my food. That'd be a huge violation right now. OSHA would shut you down. You need to have hand sanitizers at the entrance in the bathroom. All commonly touched things in the past, like salt and pepper shakers, condiments, all those like silverware, menus, those all go away. Anything that can be touched multiple times must be taken off the table. What you need to do is then have single use. A paper menu, a QBR code I've seen lately that people scan. Silverware must be individually recommend being wrapped and brought to the table. If they need salt or pepper shaker, it's no longer shakers, it's the little individual packets. Same thing with condiments. In addition to that, everything needs to be cleaned all the time. Before, where you just wipe down the table, you need to have sanitization spray. Spray down the chairs and the table after every time a guest leaves. Same thing with the bathrooms and any other high use area. As I talked about, there must be mandatory sign postage, but again, this is where you can be creative. It doesn't have to be a warning. This is where you can actually obtain and instill trust in yourselves from the customers, and you can actually invite them in because your signage is saying, we're doing this for you. And along the lines with no more multiple touch items, multiple use items. You can't have buffets, bars are closed, can't have arcades, no self-service sodas, anything of that nature. Everything more or less, not more or less, everything needs to be single use. And if we just go as the bright line rule, anything that can be touched by more than one customer needs to be discarded or put away till after COVID-19 goes away and replaced with an alternative that is single use. Now here's, again, I'm going to say this again, you'll hear me say a lot. It doesn't do any good just to come with these policies. They must be trained. For example, on the time I went to the restaurant and the employees kept pulling their mask down to talk or breathe, putting back up, not washing their hands, not using hand sanitizer, and it's right there on the patio, easy for anyone to see, that's an OSHA violation. You will get dinged, you will get fined, and possibly shut down. So it is critically important that you train all of your employees from the top to the bottom and back up multiple times on the importance of this. One other thing I want to say on the importance of training is I would recommend that you develop what I would call a COVID-19 policy for employees to sign. What it essentially says is this is what COVID-19 is. These are the symptoms. If you have any of the symptoms, big bold, do not come to work. And then it goes on to say, if you do come to work after you've been exposed, been around somebody who has it or has these symptoms, you can be terminated and fired because you're putting others at risk. And that's a perfectly legal thing to do. The reason why you want to do that is because you want to give yourself the tool that if you do have an employee that comes to work with COVID-19 and lies on the wellness check or misrepresents things or fails to tell you, you want to have grounds to immediately terminate that person because they put their fellow coworkers at health risk, and that you as an employer, they put you at a huge liability risk. So that was something that I would highly recommend rolling out right away. Now, let's move on to the hotels. A lot of the same things I just talked about with respect to restaurants applies to hotels, with the caveat that visitors should also be screened upon arrival and do a wellness check. Because keep in mind, they are going to be integrating, they're going to be in the pool areas, they're going to be in the common areas, they're going to be walking around, they're going to be just everywhere. They're not in and out like restaurants. Restaurants are outside dining only. So you want to screen, have them go through wellness check when they check in, just like you would an employee. Same thing with the signage. You want to have signage out front explaining what the rules are for your property that are compliant. Masks are required. And keep in mind, when I say masks are required, it doesn't mean below the nose, just over the mouth, or below the chin, as I see all the time. Mask must cover the nose and the mouth at all times. Now, a little bit stricter compliance in the hotels in that housekeeping is involved. Housekeeping gets into guest rooms, very intimate, where it's enclosed in space. So what that means, because that they must wear masks or face coverings and gloves at all times before they must be gloved and masked up before they step foot into a guest room. They can only clean the guest room if the guest is not there. You know, in the past, if you were there in the room and housekeeping came, you'd be like, oh, come on and get started. I'm just finishing up. I'll leave in a minute or two. That no longer is allowed. If the guest is in the room, the housekeeping must stay outside in the hall and give the guest more than 6 feet space for when they walk out so they can leave the room. Once they leave the room, the housekeeping, yes, must clean, but must minimize contact with the guest personal belongings. Some hotels in the past have taken great pride in folding guest clothes, sort of hanging stuff up, doing stuff with that extra little touch that people love. You can't do that anymore. You can clean, and if you need to move something off the bed to make the bed, you can do that, but nothing else. Also, they highly encourage, because they know that closed spaces is not good for the disease, that when housekeeping goes in, the first thing they do is open windows to get ventilation through, to have a negative air pressure in the room to let flow of air, and then clean. Also, to the extent you haven't done so already, all reusable collateral, magazines, coupons, tour books, coffee makers, coffee cups, in-room coffee makers, coffee cup, all that stuff that has potential to be touched by multiple people must be removed from the rooms and the common areas, the lobby, if they have a concierge lounge, all this stuff, that has to be removed, and everything has to be single use. Also, OSHA is now requiring, in addition to the prior cleaning procedures and policy in place, that they have additional cleaning, more thorough cleaning in high traffic areas such as hotel lobbies, front desk, and bell desk. What that entails is everything's wiped down at least once every half hour and disinfected. For example, you have wipes or sprays that goes and touches every handle throughout the common areas at least once every half hour. You have hand sanitizer at the front and entrance lobby, exit of the lobby, anywhere by the elevators and whatnot. They have also required, and this is unique, they've now made new requirements that all your cleaning agents must be on the EPA approved list. Before, you could use generics or whatever you wanted. They didn't designate. Now it has to be EPA approved, meaning it's strong enough. Now, another thing too, because of the cleaning, if you can, OSHA and others are recommending that you cycle through vacancies. So a room is vacated, it is cleaned, remains vacant for 24 to 72 hours before another guest goes in, to give the room sufficient time to let whatever, if there is any residue from the disease, it dies off before the next guest goes in. Now here comes that's all sort of behind the scenes. Now this is where it gets unique and it becomes a little harder to do, is what's guest facing. Now, doors have to be propped open at hotels. Guests can't touch doors at all at the common doors. You can't, guests and are used to it, roll up to the valet. Unfortunately, valets can no longer open the doors. It's really sort of awkward, because I went someplace and the only parking available was valet. I roll up and I just sort of sit there waiting for the valet to come up at my door. And he stood up there outside for a few seconds before he realized that I didn't know what was going on. And they had made a sign that was laminated that says, please open your door as we cannot. It was simple. And then once I opened it, the valet chuckled and goes, sorry, it's our new rule, we have to comply. I'm so sorry. I had to put my hands in my pockets because I want to open your door, and we all laughed about it. But just know that that's the new rule. The restaurants and the hotels and the lobbies or wherever it is, they have to comply with the outside dining only, no inside dining rules. So that means it's only takeout, carry out, only room service. But it's no longer allowed to have restaurants in the lobby or whatever it may be that are dine in. If you have a pool, if you have elevators, or if you have any of those type of common facilities, you must now put up signage and regulate things so that you can maintain social distancing. For example, at elevators, you may have to put up those stickers on the ground that says, please wait here. over 6 feet apart so guests don't congregate in the elevator lobby. When they're in the elevator, you get put signs up there, limited to 1 guest, 4 guests, 2 guests, whatever you can safely do and maintain social distancing. For example, at my office building, they're allowed, because the elevators are large enough, 4 people per elevator, and there's a little round sticker in the corner of each corner of the elevator. It says stand here, and that is it. Now, what that means though, if you get there and everybody's coming to the office at the same time, it takes a little bit longer. But those are things that same thing where I was talking about with reimagined procedures and practices for the restaurants, do the same thing for the hotels. How can you do it in such a way that you comply with the social distancing requirements and make it inviting for guests as much as you can? Now, what are some common questions? One comes up all the time is what potentially happens if you refuse to follow the state, county, city public health order requirements? You can be fined big time. That's the short answer. There was a restaurant in the Monterey Bay area that, thankfully, it was not one of my clients, but I read about in the paper. He refused to honor the outside patio no dine-in rule, blatant about it, was arrested, and then fined $25,000. It's gotten to the point where the state is no longer taking this as a laughing matter, that it did, but then also it's coming down on cities and individual municipalities saying, you don't honor this, we will make sure that you pay. And they are withholding money from individual municipalities. So if you get, it won't be a slap on the wrist. It won't be like, okay, here's your little fine, or here's your written warning. No, it is a monetary fine, and up to and including being arrested and having a criminal charge brought against you as a proprietor of the restaurant. Another question is, what happens if employees refuses to return? Well, the question is, well, why? Why do they refuse to return? Because under the FRCP, the Families First Coronavirus Act, if they fail to return because they have COVID-19, somebody else, they're quarantined, and there's several different things. They're caring for somebody who has coronavirus, they don't have childcare or whatnot, they get up to 2 weeks leave. But if it's just, well, I'm scared, but I don't have any medical reason for being scared, that's not a valid reason. Same thing if you're under Governor Newsom's executive order for food workers. That applies to all food workers in California, that if they cannot come to work because they're under quarantine order, have been exposed to COVID-19 and whatnot, then they also have protected leave. So yet it's very fact specific on why they're refusing to return. And if that ever comes up on why they're refusing to return to work, I would highly recommend that you reach out to legal counsel to make sure that if they are refusing, to determine, one, is it a legally protected right or not? Because if it's a legally protected right, then there's very serious, finite things you have to do to make sure that you comply as an employer. But if it's not one of there's 6 different reasons why they would fall into one of these protections, then they have no right not to come to work. And that can be grounds for termination, for it's a refusal to appear for work. What do I do if an employee tests positive? Now OSHA has spelled that out. And if you guys have any question about what to do, simply you can either send me an email or you can Google OSHA COVID-19 restaurant regulations, and they have actual regulations on that. But you need to immediately tell them to quarantine themselves for 14 days. You need to ask them, do the tracing, who they come in contact, when they last work. Then if they've come in contact with anybody at work that it's within 6 feet for more than 15 minutes without a mask, you may need to advise them to quarantine, and that's all paid leave. But that's something else that we can help you with as well, or Nicole can as well. There are specific tracing requirements that OSHA has put together, and depending on the locale and where your restaurant or hotel is located, or a business, there can be specific requirements there too. What if employer customer gets sick? Can the restaurant be liable? That depends. Why that depends is have you been negligent? Did you fail to put into place safety protocols for COVID-19? Did you require employees and customers to wear masks or not? Did you have the cleanliness and extra procedures in place? Did you do social distancing? Did you redo the processes, the flows to prevent people coming within 6 feet of each other? If you've done all those things, then arguably no. But well, I'll say it's caveats, California, so somebody could always make a claim, but not under any of the statutes. Now, if you don't do those, and you did not take reasonable measures to prevent exposure to COVID-19, yes, you can be liable. Can I have everyone sign a liability waiver? I don't recommend that. And the answer is no. Now, another big element of this is companies have in the past furloughed employees and are ebbing and flowing as, for example, the PPP money runs out or business picks up or whatnot, is how do I determine who I bring back from furlough? If I did a temporary layoff, how do I determine who I hire back and how many? These are always challenged by law, not by law, challenged legally of whether or not when people are rehired, if they were done legally. Was there non-discriminatory reasons used and whatnot? So what you want to do is utilize a objective non-discriminatory criteria such as skill set, education, or tenure. I tend to go with tenure because it's the easiest one. We're going to call back the people that have worked here the longest, period. And it doesn't take into account any other criteria. Another thing too is you can consider voluntary callbacks. So it's not up to you. You didn't make a selection, so they can't claim you did and used some discriminatory criteria. Simply put a call out to all your employees who would like to come back to work at these hours. You may have some people say I would. Some people say I want to stay on unemployment because I'm making more. Or some people say I just don't feel comfortable yet. I'll take my chances getting hired later. And as we're in all these, you got to focus on the objective, non-discriminatory reasons. You have to comply with requirements for non-discrimination and non-retaliation. So if somebody decides not to return to work, then you can't later terminate them or discriminate against them in rehiring. And also, what if they make an accommodation request? You can't punish them for that either. So all these things have to be taken into account. When you go through this, though, you can't be just, okay, I'm going to go with tenure. Any rehiring plan must be written down, I recommend, to demonstrate that it was thought out, it was not capricious, it was not subjective, it was very specific and thought through on who is bringing back, because we're already seeing that lawsuits are going to happen. Then, like I said before, I would go on a seniority-based system because it's the safest. Don't allow local managers to make the call, because if you do, what's going to happen is they're going to tend to hire, and I've seen it a lot, those people that they like. And this is not a critique on them. This is nothing negative, but people tend to like people like them. People like them tend to be the same race, same age, same sex, speak the same languages or whatnot. And that can end up by default being discriminatory, because if there's a manager is a female Hispanic and she wants her friends working with her, she gets to choose. And so she only brings back the other female Hispanic employees, does not bring back any of the males, does not bring back the elder employees, does not bring back the African Americans or Caucasians. Even though there was no discriminatory intent, you're going to have a lawsuit on your hands for discrimination. So that's why you want to set up the criteria with the sort of at the management level, at the corporate office level, and implement it that way. Now, how do you restaff? How do you reschedule? You want to when you bring people back, you again want to apply objective criteria to how you staff. So it's not, again, your favorites. And that way, because there's already lawsuits popping up, it's uniform across the board about who was rehired and who was staffed and how they were staffed. So it's even and equal across the board. And I highly, highly recommend that you get arbitration agreements in place, because There are going to be so many lawsuits on this, and there already are, so you want to protect yourselves. But one of the things that can prevent those lawsuits and can prevent disgruntled employees is communication. And 9 times out of 10, when I've been involved in employment disputes, before they turn into litigation, they are often diffused by just communicating properly to the employee. So when you communicate, don't just rattle off an email real quick or a text or a phone call. Stop and think if there's a complaint. What's the strategy? Let's set up a schedule that allows you to get to the bottom of the information before you call. Figure out your audience. Is it a crew member? What's their native language? Who are they most comfortable speaking to? And based on that, who's going to deliver the message? Is it going to be their manager, or do they need somebody higher up? How are you going to communicate with them? It's going to be over text, it's going to be email, it's going to be in person, it's going to be over phone. And you want to do it in a way that feels the most heartfelt, so that the employee feels like when they're done with the communication, they've been heard and that they have been understood and their issues have been addressed. And they walk away going, my employer cares about me and my concerns. Okay, let me just skip over this because we're getting close on time here. Is one thing to keep in mind through all this is under the Families First Response Act, the FFCRA, is that act created 2 new sick leaves, the Emergency Paid Sick Leave and the Emergency Family Medical Leave Act, which are in addition to the other ones, the FMLA and other acts that already exist. And this is what I was talking about earlier. They are entitled to, if they're a full-time employee, 2 weeks paid sick leave if they're unable to work or telework due to one of these following 6 reasons. And it has to be one of these for them to qualify under the FFCRA. They're subject to a quarantine, they've been advised to self-quarantine, they're experiencing symptoms of COVID-19 or have COVID-19, they're caring for an individual who's subject to quarantine, they are caring for an elderly or child whose school or childcare is closed. And this is the loose one, but basically if they're experiencing any other symptoms. This is where I was saying earlier, if somebody says I can't return to work because of COVID-19, you need to ask them why. Because if they meet any one of these 6, they're entitled to 2 weeks protected paid leave. And you want to make sure that that is covered. And you want to make sure that you don't accidentally step on a landmine by not honoring their request for a leave if it's one of these 6. Now, can't forget that we also have the other laws in effect, leave laws. And one of them, which the Emergency Family Medical Leave Act dovetails on, is that they are, just like the FMLA, they're entitled to 12 weeks of protective leave. When? And this is, again, you have to be very specific here and make sure that it's enforced and complied with, and put the sort of employees to the test. And this is where you want to get legal counsel involved. And by the act, it says the employee is unable to work due to the need for leave to care for the son or daughter under 18 years of age of such employee if the school place or place of care has been closed or the child care provider of such son or daughter is unavailable due to public health. It's not paid leave. They're entitled to 2 weeks and then another 8 weeks of unpaid, but it's protected leave. And as part of this, we highly encourage that you have them complete a form similar to this, and we can provide these to you, or I'm sure Notebook can too, but it puts their name, their date, and it has them check the box of which of the leaves which are the reasons for leave that they're requesting, so that it makes sure that they meet it and you're in compliance with it, and they aren't just asking for leave and you're rolling over. Now, keep in mind that all the labor code laws still apply here, and the wage and hour applies here. So for example, the reporting time law of paid for 2 hours in California applies. So if somebody reports to work and they test at a temperature of 100.4 or higher and they have to be paid reporting time pay. If they come to work and they fill out their wellness check, it takes them 5 minutes and they can't clock in until they complete their wellness check, then you need to ensure that an extra 5 minutes is added to their time. If people do not work the same number of hours, or their pay is reduced, and they were an exempt employee before their pay was reduced or hours reduced, you need to make sure that they still qualify as an exempt employee. Because what can happen is if their pay or hours are reduced, their annual pay may not meet the requirements to be still considered an exempt employee. In closing, just remember this: the more you plan to prepare, the easier to perform. Once you perform well, it's easier to probe if there's any weaknesses or mistakes. You can proceed and you can persevere, and you'll get through this. If you have any questions, Fisher Phillips is here for you. All we do is employment labor. All we do is advise on this. We have people across the country who are now specialists in the SBA and COVID-19. We are reading stuff every day as it comes out. And with that, I have no further things, but if you have any questions, let me know, and I'll turn it over to Nicole now.
Awesome. Thank you, Tyler. Thank you so much for presenting today and providing your insight into how restaurants and hotels can navigate through this pandemic. Very important. Let me switch over my screen here. Okay. And I want to let everyone know that Tyler will be sticking around until the very end of our presentation for our Q&A segment. And now Richard Cox, our sales director, is hopping on. Let's see if his audio is on.
Hello, everyone. Yeah, hey, thanks for joining us. Tyler's spot on, absolutely spot on. In today's times, thanks for that extremely informative information for our customers.
All right, so I am working on this PowerPoint. It's automatic, so I may need to switch it up a little bit here, but Richard and I are here to talk a little bit about some of our solutions, some of our contactless solutions, just pretty briefly here. So we'll start with our NCR Aloha Essentials program, which we are currently running. And here's some of the details on the slides. I don't know if I can pause this, but Richard, do you have any? Oh my goodness.
I do. Hey, thanks, Kim. Don't worry. We'll kind of go through it. Hey, first of all, I want everyone to know we're not here to sell you. We're here to help you, and that's really, really important. So a couple of these points that we're going to talk about before this call concludes is just things that are out there that NCR Aloha and I3 POS being your provider can help you guys with in some very, very challenging times. And if there is any interest, any help that you need out there, do not hesitate to reach out to us. We've got we've got a great staff that will do their best to help guide you through these troubling times. But Essentials, basically, today, many of you have purchased POS systems through us, and we call it a traditional sale where you just paid for the equipment, you own it, you pay for services on an as-needed basis based on what you need. You may have some of our cloud solutions products and pay a monthly fee on that. Well, with Essentials now, it is just a great program where you can actually future-proof your POS product. And what I mean by that is that as things change, we're seeing today with COVID that people are looking for contactless payment options. They're looking for pay at the table options. They're looking for ordering at the table options. Well, in a traditional sale, you might find that, hey, I've got now today more terminals than I need, but I could use some other ordering devices. And with Essentials, you can actually build and purchase what you want. You can subtract from your current contract, because this is a 100% subscription model that covers the software, the help desk, on-site services, and all the hardware. Everything is included. So where you as a customer before, would have to year two buy different things, this is all built in. One monthly fee covers it all. We also have built into it the cloud solutions products that you guys use. There's tremendous discounts with the bundling that goes on with that. But the key is things change. We don't know what tomorrow is going to bring. But it's kind of a neat program that now you can add, subtract, or make and modify a program that best suits your business needs today. And you only pay for what you use. So that's Essentials in a nutshell. Again, quick overview, but if anyone is interested with anything that's going on out there, maybe they've received from us a quote to do an update. Maybe you have 5-6-year-old equipment out there. It may be a fairly substantial amount to do an upgrade. Essentials is very attractive way to now get on something that will take you from now and forever. And by the way, the key elements, i.e. terminals, your controllers for the kitchen monitors, your manager's PC, within a 5-year period, get completely updated to the latest technologies. So that's all I have on Essentials for right now. Thanks, Kim.
Yeah, love it. Thank you, Rich.
You're welcome. And then the next slide, just bring it up real quick. As you're bringing it up, I'll talk about is mobile pay. And I don't know, actually, okay, this slide here is actually on our pay at the table option. So we have an Equinox unit. That unit can have either a printer built in or not have a printer built in, but the staff members able to go up to a table, put in their server number, put in their table number, pick up the check, and do the payment right there at the table. And we also support the different contactless, Google Wallet, etc. Other currencies out there that many of our customers are using today, and it's all embraced now at the table. And again, with a printer, again, you can have a nice little roll there where you can print that receipt right at the table too. That's our 6200 Equinox mobile pay at the table device. And then the next one we're going to go to, I believe, is going to be our mobile pay. And there we are. I'll tell you, very interesting story. I could keep you guys on this phone for 3 hours and I won't do that to you. But this product actually came out in its initial form in 2012. And you know what? The response was extremely low. And I think everyone, things have changed. Today, this is one of the hottest products going right now. We have a tremendous backlog. This allows a guest, you can see this little QR code right on the printer. So imagine at the bottom of your check, you have a little QR code. The guest just hovers their phone over that QR code. It brings up the check. You look at what you got on it. You put your tip on. You input your credit card information, and you make the payment. The next time you come to that restaurant, it's got the saved card there. It's fast, it's efficient, and it's contactless. And the customer brings their device in. And it is an extremely low monthly cost for you as an end user. And I think, I might be off, but we've got currently about 250 sites coming up on board on this right now. And then we have other sites that have been up for quite some time. So that is our NCR mobile pay. But with all these things we're talking about, and I think we have one more key element for you too. And i3 not only is your POS provider, but we also are a leading credit card processing company. And again, with that being said, I want you to know that if you are interested in getting a free rate review and where we can save you money on a monthly basis, we've got a team of specialists that have been in this industry on the credit card processing for years that would love the opportunity to see how we can help you save money and, all of us keep growing. So I appreciate the time that everyone's put on the call. Do we have any Questions there, Kim?
So let me look at our questions panel here. Also, just say Tyler's information is down here below, as well as mine, if you're interested in contacting either of us directly. And then, of course, just chiming off of what Richard said, we do have a bunch of great solutions, contactless solutions, such as online ordering, which we didn't really discuss today, takeout operations, our Engage app, Pulse Real Time, advanced reporting, and so much more. So if you have any questions about any of this, please feel free to email me directly and I will get those answered for you. So yeah, before we close out today, I'd like to go over some questions. Let's see what we have here. And feel free to type in any questions now or follow-up questions that you have. The chat box is on the right side of your screen. I believe there's a questions panel. So first question is for Tyler. How do I handle customers who refuse to wear masks? A great question.
So on that one, that's a great question, because as we've seen throughout social media, there are people who, no matter what, will refuse to wear masks, thinking it's their legal right. First, at least within California, you have to understand that you are permitted to require employees and visitors wear face coverings, period. It's the law. So you can rest on that and say, sorry, it's the law. I didn't make the law, it's the law. That's one, you have to understand your rights. Two, be proactive with your mask policy. Like we're saying with the signage, have a sign out at the curb before people get to the front door. Mask required. If you don't have a mask, you will not be permitted to come in. I was on a flight recently on Delta, and Delta said, masks are required on this flight. If you refuse to wear a mask, I know several of our competitors will gladly accept your money. So and everybody sort of laughed about it. But they said it before, like 45 minutes before we started boarding. So be proactive in how you approach it. Third thing is that training I talked about. Train your staff on what are the rules, what are the requirements, and how to deal with it. How to have a employee or manager at the door, or somebody, a point person who deals with it all the time and they're trained. Fourth, you have to understand that under the ADA, the American Disabilities Act, if a person cannot wear a face mask for a particular reason, a medical reason, for example, they have a pulmonary condition, they have a condition with their nose or their mouth that prevents them wearing a mask, then under the ADA that they are entitled to reasonable accommodation. But they still have to have a face covering to come in, period. So they can have a face shield, they can wear a bandana, but that does not obviate them of the need to wear a face covering. Also understand that if somebody presents a card for anything other than a medical reason, say that it's a political or it's their constitutional right or it's some rights or any of that does not alleviate them of the obligation to wear a mask. And the only basis for a person not wearing a face mask is that they have a medical condition that you can reasonably accommodate through a face shield or some other matter. And lastly, just make sure that you have a point person who is trained to delicately address and deal with customers and visitors who refuse to wear their mask, so you don't have a social media moment there. And it's trained and specifically trained on how to diffuse the situation. So thank you.
Very nice, lots of insight there. Thank you, Tyler. Moving on, I see a question for Richard. Richard, the attendee asks, how does online ordering work?
Online ordering, what we do is we set up the menus for you. It works off your website, and what will happen is the customer will place that order, and then it will go directly into the Aloha system. It will go to the screen or the printers at the predetermined amount of time, so that when that guest is going to be either picking up that order or that order is to be delivered to them, that we have the right amount of time to make that product and take care of you. And anyone that's interested in learning on our online ordering, I suggest please, Kim's going to be sending out a survey, and let us know that you have interest, and we will have our Aloha online ordering specialist reach out to you and discuss exactly how it works in the process. But it is all integrated, it's not standalone, and it works very, very well.
Awesome. Thank you, Richard. Let's see. Another one for Tyler. Does Cal/OSHA, OSHA, have specific requirements with respect to operation of restaurants or hotels?
The answer is yes. The Cal/OSHA actually issued well, specifically the governor issued a handbook recently, and Cal/OSHA has two different, what they call guidelines on restaurants, bars, dining restaurants that will lay out what exactly their requirements are and need to be done. For example, they have one that is the one for hotels in particular. And if we have them, we can get to you, or also, frankly, you could Google it. And if you Google it Cal/OSHA COVID-19 hotels, but it's the OSHA's industry guidance for hotels and lodging. It's a 12-page report. It was just issued earlier this month that provides an overview. It tells you exactly what is required for face coverings. It tells you exactly what needs to be included in the workspace specific plan, the COVID-19 plan, the training, and whatnot. It goes through in great detail. It's a wonderful resource, because if you have that in hand, if that is available at each one of your properties, there is no doubt about what the OSHA's requirements are. So I'd recommend that you look at that. It's nicely done and provides you the exact details you need to know.
Perfect. Thank you, Tyler. I see we've got another question that just came in for Richard. How does the mobile payment integrate with the POS?
Excellent question. It is seamless, but literally your payments are updated directly in there when the guest makes that payment. When they literally just open their camera up and push a button, the check comes up, you review it, you put your tip on, you put your credit card information in, and bam, right into your system, and it's all updated. Seamless, easy, and you probably have seen our product out there in quite a few sites there. We have a lot of our multi-units have implemented this product, and like I said, you'll be seeing sites all over Southern Cal and Pacific Northwest very shortly, because I think it's well over 250 sites right now we still have to get installed.
Okay, great. Just a reminder, please type in any questions if you have any. I see one more so far for Richard. How soon can we get mobile pay installed, may I ask?
You know what's great about that question, and I hope other people are asking that same question? When this survey comes out, please fill it out and say, I want to learn about mobile pay, because then we can get you in the queue and have you up as soon as possible. Exact timing on that can be discussed. We do have to verify that the current system requirements that you have are met. And what that means that, in some cases, some of the hardware or software may need to be updated to be able to support it. And in many cases, it does not. So again, timing really will be more dependent on the current equipment configuration at a particular location.
Perfect. Great answer. So I'm not seeing any more questions that are coming through at this time. So I just want to thank everyone for joining us today. Thank you, Tyler, for presenting for us today as well. And I will be sending out a short survey, as Richard mentioned, via email, where you can provide feedback and also get in contact with an I3 representative if you're interested in learning more about some of the solutions that we discussed. And also, please feel free to email me directly. My email is right there, kmontgomery@itverticals.com. And I'm looking forward to our next webinar and hope to see you next time. Thanks, everyone, and have a great rest of your day.
Tyler, thank you so much.
Thank you, everyone. Have a good one.
Thank you.